Hwolshe Medical Center here in Jos Plateau State, North Central Nigeria. It will interest you to know that Dr. Dr.Lenkop has been a former local government chairman of Kanke local government here in Plateau State. He is somebody who has paid his due. He has passed through the Rubicon of politics, and he's into community service and developmental service in the healthcare center. So it's a pleasure to meet you, sir.
Thank you.
Sir, can you briefly tell us about yourself, sir?
Well, as you have introduced me, my name is Dr.Danlami Lenkop. I'm from Kanke local government. I've worked with the government, got retired, went into politics, became the chairman of Kanke local government. But I was appointed, and I also had the opportunity to win the election to be an executive chairman. So when I left office, I started the clinic, Hwolshe Medical Center Annex, along Tudunwada Ring Road. And that is where I work up to now. But I'm still very active in politics. As everybody will know, I've been in politics, and I'm a full member of APC, a stakeholder. And outside the health program, I go out and play some politics.
Yeah, let's take you from Hwolshe Medical Center, where it seems to be your primary assignment. Yeah. What will you say are some of the challenges you've had to encounter so far?
Well, Hwolshe Medical Center is a limited company, and so, like, if there's problem in the country as regard financial flow, it will affect everybody. But in actual fact, we offer health service to the community, people within Jos and outside Jos, and even from other states, they do come. Principally, I do surgery for most of my patients that come with surgical problem. We now discover that to run a clinic now is a little bit expensive. Medical equipment are expensive, consumables are expensive, but that challenge is not being met by the resources of the society. People are having problem of accessing the health services, and as a company, we still have to charge to be able to pay salaries and maintain the place. And some people will come, they don't have resources. In fact, we have had a lot of patients that after operation, we do everything. Before you know, they're abscond, and you can't get to them. And even if you get to them, there's nothing you can recover. So we have those challenges that resources are dwindling. Yes, Nigeria is one of the resource-limited countries. But of recent, I think it's taking a serious toll on us. We are still offering our services. And the other problem is that, well, if you're running a private clinic or a private business or any business or any company at all in Nigeria, you must have a standby generator or solar system. That is one thing that also consumes money. If the government can provide us power continuously, would have helped a lot. Because maintaining solar and generator are much more expensive than the NEPA supply we used to have. Another area is that in those days we used to have a good supply of water, but now you cannot run clinic without water. So we have to have borehole, and once in a while you have water from water board. The question is whether the water is really potable or not. We don't know, because sometimes you keep water, you see debris, and the hospital cannot use such water, especially when you come into keeping your equipment. You may use it for washing, laundry, and toilets. So these are some of the resources. Then you discover that we face a lot of challenges in multiple taxation from the state government, from the federal government, from the local government. Everywhere is taxing. Like I've talked about generator, they are taxing now. There's a tax that is awaiting us that we have to pay for generator as far as climate change is concerned, or ecological form. So those are the things that we are being faced with. We believe that if it is a social service, humanitarian service, some of those things can be wiped away. I know that in some places, you are even augmented with some resources from the government to help you run the place. Obviously, we want to appreciate the government effort of registering and starting the plus schema, which is a health insurance type of thing. Yes, we've just started. There are a lot of problems. We just believe that it will be sorted out. Otherwise, the resources coming from them is dwindling. The capitation is paid as 400 per person for you to take care of his health in a month. Now that everything has gone up, I don't think 400 is enough to do anything for us. So we are appealing to the government, state government, to look into it, to see whether they can improve on the capitation. And even their tariff is a little bit low. In Nigeria, if you go to the market in the morning, you get a different price. In the afternoon, it's a different price. In the evening, it's a different price on an upward review. That means that if you fix tariff or you fix capitation about 4, 5, 8 years, now it's almost obsolete. It will not help again. So we are appealing to the state government to look into it. The federal government also have National Health Insurance Agency, which we are keyed into. Their capitation is slightly higher than that of the state, but it has been long that it has not been reviewed. So, and we want to believe that the aim of health insurance is to offer quality and affordable health care delivery to the society. And we cannot do that with a matching resources. So that is why we're crying loud that for us to achieve good care service and it should be affordable to everybody, then both the government, the individual who run clinic should cooperate and see how we can afford that.
Yeah, as you have said so much, despite some of these challenges you have mentioned, many people still see you as a success, considering your pedigree when you held sway as local government chairman, and with the challenges in the healthcare, you have been able to surmount them and still going. So people see you as a success. What will you really attribute to being able to be on the game, despite all these challenges?
Gain of the clinic?
Yes, the medical sector as the CMD. Despite the challenges you have still been on.
Well, that is how we have to starve ourselves of some of our necessities that should make us happy and just take care of the health of the individual. If somebody will come now with a case you want to operate in, you say, okay, 20,000, you say 15,000, 10,000. What do? You help him. But it means you are sacrificing somewhere so that what you are supposed to get for yourself and to run the clinic is going to be limited. Because if you really want to charge, how can somebody be given 400 naira to take care of his health? I know it's an insurance, but yes, insurance, when we started, we were told that if 15% of your enrollees attend the clinic, then you are running at a loss. And in Nigeria, you know that it's a sick society. It's a development. It's not a developed society. So you will always have people coming to the clinic all the time. So that, because the aim of insurance is that some people will pay for some people. But in Nigeria, most people will come to the clinic. So you still have to suffer. And we have to sacrifice some one or little thing to make sure there's some success.
Yes, sorry for interjecting. In public relation, there's a concept we call a unique selling preposition.
Yeah.
What has really been the uniqueness for your medical outfits, Hwolshe Medical Center?
The uniqueness is that we try to sell our service to people, and as much as we could do, to subsidize where we can, to help people access it, and also try to give quality service to our people. But we have had cause to also talk to people that this thing we are doing is not helping us much. So sometimes some people see reason into it, and you charge them, they pay what they can afford. But like I told you, we have had a lot of patients running away with our resources, and people had advised that we should go to court or take them to police. But I say no, allow them. Some of them don't have. Yes, I know that some people that maybe they did it intentionally, but some actually don't have. So what do you do? The small I have, we have to share with them.
Yeah, is there any attempt to attract donor agencies? Because we've seen some partners.
Okay,
Have you been able to succeed in that direction?
I have some agencies that will work with them, like APIN, AIDS Preventive Initiation in Nigeria. We work with them closely, and the TB section, we also work with TB very closely. Those drugs are provided to us by federal government and the APIN to give to our clients free of charge. So they access that one free. So if you have TB, you have HIV, you can access those. We offer comprehensive health services in those areas. You can access it. So they are also helping us. With sometimes they even give us some incentives. They give us some equipment to help us. So I think they are our partners that are helping us also give quality services, especially in terms of HIV and tuberculosis. We on our side, yes, we have not liaised with any other parts, international donor apart from these two.
Yeah, as we have a new government so far on the plateau, is there any plans towards making some of your challenges known to the government? Because you are partners in progress to the government.
Yes, when we have the opportunity, we will talk to them and tell them these challenges cut across all the private practitioners. Today, I was called from the Ministry of Health that there will be a meeting with the Commissioner for Health on Monday, Tuesday. We hope we table some of our problems to him. And even the government that left, we had cause to talk to them about this multiple taxation that I was talking about. And they promised to look into it. So we are not just keeping our problems to ourselves. We will talk to them. And the new government, as I said, if we have meeting with them, I'm going to represent the private practitioners in that meeting. So I'm so glad that we should be able to table some of our challenges to them.
Yeah, as there is the issue of over the years, it has been said that malaria kills faster than even any other things. What do you think the government has not really done well in terms of alleviating the scourge of malaria?
Malaria, yes, malaria, of course, there is some private or international organization that started in Nasarawa, and they are coming to Plateau State for treatment of malaria. If your health facility is captured, both private and government, if your health facility is captured, you'll be able to offer free malaria service to the society. They've just started, and I don't think they have gone too far. But even in Nigeria, even in the state, I think there has been some moves for the prevention, like the insecticide treated nets, so that you can use, so that you prevent the bite by mosquitoes who transmit the disease, the malaria. And then most of the health centers, government health centers, primary health centers, I think they've been given, from what we learned, that some of them actually have drugs to treat malaria as a very subsidized or free service. And as you said, we are hoping that malaria will be treated like HIV is treated free, TB is treated free, because yes, malaria is a killer disease, especially in children and pregnant women. So the government, they have called us for meeting one day that they are looking into it and they're going to do something.
Yeah, as you have said so much about malaria, but let us just a bit take you a bit to the national. Recently, the present administration in the national has appointed the Minister of Health, a
Yes.
seasoned practitioner in person of Dr. Pate.
Yes.
If you want to set an agenda for him, what are some of the agendas you want to set for him?
Well, yes, number one, we should focus very seriously on diseases that can be prevented, like communicable diseases. We've talked about malaria, we've talked about TB, we've talked about there's polio, there's HIV. All those preventable diseases, we should focus on them. Or communicable diseases, we should focus on them. Of recent, you have other scourges like Ebola, you have cases like COVID. All those things are preventable. So the government must have a system on ground, and especially when you have epidemics, we should be ready to combat it. And I think Nigeria was given kudos for combating Ebola as fast as possible. Even in the COVID management, I think Nigeria did very well. We should sustain that and improve on it. The other way, I've complained about the the health the health insurance agency. I think they should look into it and be reviewing the policies continuously. Like I've talked about the capitation, they're not improving on it. You cannot start paying people for 5 years or 10 years you've not even reviewed. Even the drugs price, you should review it I think the government should also help in reviewing the prices of those things that will help the National Health Insurance Agency to succeed. Uh, well, we have also heard about quackery everywhere in Nigeria. I think they should set a committee to look into that seriously because it's surprising that you find a lot of quacks in the medical profession. Yes, I know that quackery is everywhere, in every profession. I'm sure even in your profession, you find them. Uh, Soldiers or military people call their own fake soldiers, fake police, fake that. When they come to medical practice, you call them quacks. Even in teaching profession, they are. So the government should. But for you to have a lot of quacks in medicine or in the healthcare system, I don't think it's good for us. Uh, we heard about people removing kidneys. For what reason, I don't know. We heard about people having substandard clinic and people have been dying there. They are dying there. They should put in something in place to check the quackery. That will also help the society in getting very good health service. On the government side, as the government workers and the rest, they should look into their complaint. Most of their complaint is sometimes remunerations, sometimes the facilities to work with. By this time, we shouldn't be traveling out every time for treatment, what they call medical tourism. It should be reduced to the barest minimum. But we discover that people are going there because something is lacking. If you are going there just because you want to go, it's a different issue. But you are going there because that service, the basic services are not available in Nigeria. It's funny. We should have at least a standard clinic, international standard clinic. If not in every state, then it should be in every geopolitical zone, so that people will stop going abroad for some of these ailments that we are facing. Uh,
Yes, in terms of the what is popularly referred to as the Japan syndrome, I know you may have had offers to travel based on your pedigree in the profession. You've decided to stay locally and do and make your contributions. What are some of the steps do you think government should put in place? Do you think they'll be able to stop it? What is your take on that, sir?
They will stop it with good remuneration. See, people talk about greener pasture. Everybody wants green pasture. If you now you have a good offer somewhere, you will go, isn't it? But I know there are some people that with all that good remuneration, they're still within the system to help because there's no assistance that you're giving a community that you think is too small. So people sacrifice to offer that. But what we are saying is that the government should also look at it. Apart from the salary we said, I said, let people have enough equipment, consumables, thing that when you go to work, you work well. Not to begin to say you call for this is not there, you call for that is not there, there's no light. You want to go to operate, there's no light. Some of the general store when you enter, you find out that there's completely nothing. You don't have generator to augment the PHCN. So and then you may not have even clean water in that place. And the staff are also not remunerated well, and even by the quality of the staff, you may not have enough doctors at hand, the nurses, all the various sectors may not be enough to service. For example, you can run into a big general store and you find just one doctor running the place. I don't think it's enough. Now people are even talking about specialization. If we cannot get specialized doctors or health experts in the various sectors of the health system, we should at least get in the major ones like surgery, obstetrics and gynecology, pediatrics, and internal medicine. At least we should have those ones before we talk about other subspecialty like ear, nose, throat specialists, neurologists, nephrologists, cardiovascular surgeons or cardiologists, all those ones are there. But for now, in our general hospital, I think we should have the basic ones so that if they cannot afford it, then they can refer. So that brings us also a very good referral system. I know that in medicine we've been taught that first of all, do no harm. If you cannot help that person, don't harm him. So the health expert should know that so that if you are in a general hospital, you cannot handle, you refer. If you are in a private clinic, you cannot handle, you refer to the or to the higher health care facility. I think these are the things we should do to improve the healthcare services. The government really need to set a very good committee to look into our problems and then see how we can solve them.
Do you think the current Minister of Health is in a round peg in a round hole?
Definitely following his pedigree, he is in a very good position to help change the system with the cooperation of the president and any stakeholder, any critical stakeholder in this business, because you will also need the cooperation of the executive at the national level, the president at the national level. Because if it comes to resources, who gives the resources? Who gives the approval? If it comes to equip the places, who is going to sign for that? So he will not work alone. He can have all the knowledge to make everything go well, but then he will need the support, the listening ear of Mr. President.
Yes, before we move down to the other part of the interview, as a stakeholder on the Plateau project, and many governments have passed through, are you truly satisfied with the attention previous government have given to the health sector on the Plateau? On a sincere note.
Yes, I think I have talked about that before. It's like we are putting more, politicians, we put more emphasis on structure. They will keep on building structures, primary health center, general hospitals, and specialized hospitals. But when you come to look at the manpower, they may be deficient. When you come to look about the consumables or the things that are the facilities in the health sector, in the facility, you may not find much. But because you are passing, you see a very big hospital, then people are happy, you commission it, people are happy. I wish we should look into, yes, we have that structure. What service can we deliver to the society? So that means that takes us to the manpower. It takes us to you cannot have a very big place and you go there, you cannot find anti-malaria. There's no need for that. So we should combine the two as much as they are doing. The Before the last government leaves office, I think they did some employment. They have to be they were employment of health personnel and any other thing. So we hope those ones will help. And the present government that has come, let him also look into it. The maintenance of those facilities, the maintenance of the civil service or the health care workers, so that they will be happy.
Yes, on a last note on that aspect, on this aspect we'll be looking at, where do you hope to see Hwolshe Medical Center in the next 10 years?
Well, I would like to see it going up, to grow up to a standard, but I'm also a retired civil servant, and there's a limit to what I can do also because it will come to a time that you may not be able to run the clinic effectively. But I hope to hand it over to the younger generation, either within my family or any other person can take care when I discover I cannot offer good service to the society again. And well, it's a hospital that you can develop on it. It's not too small, it's not too big. And some facilities are there for people to use. It's quite popular enough, so it's a matter of upgrading it.
Yeah, viewers, we have been discussing with Dr. Lenkop, the CMD Hwolshe Medical Center, one of the fast growing medical institutions on the plateau. And he was once a local government chairman. He has consistently contested for various seats in the states and plateau. He is retired civil servant, but not yet also tired. Sir, you have been in politics. Let's move to the political arena. Uh, your stay as the chairman of Kanki local government on the plateau, people see it as one of the best seasons that local government has ever had. And all of a sudden, we saw you vying for one or two positions.
Yes.
But I think at the last dispensation, we saw your posters. Can you briefly say some things about your political foray so far?
Uh, it's, Politics is very interesting. My experience in politics has been very interesting. I started, as you said, as a local government chairman. I contested for the seat and I won the primaries. And along the line before we went into the secondary election, we were appointed as caretaker into the local government. And after some time, I resigned and went and contested for the executive position, which I also won. And I did my best as a local government chairman, even though we did not finish our tenure, just like what is happening everywhere. And that's what we've been saying, that elected people should be allowed to finish their tenure, because by constitution, that is what it's supposed to be. But a lot of people have broken that constitution. I think we were the first casualty in Plateau State as elected local government chairman to be dissolved before our tenure ends. So after that one, yes, I've been playing politics. I contested for House of Rep. I didn't win. I contested for state chairman. I didn't win. The last one was the contest for the contest for the governor's seat of Plateau State. Yes, I started very well. I lobbied around within and outside the state. I got support of people. But politics is like, I used to tell them that time that you have landlord of the parties. In each party, you have the landlord. And if you don't find favor in them, it will be very difficult for you to scale through the primaries. But if you find favor, then you scale through easily. Uh, but in any contest, somebody must win, somebody must fail. So I don't have any grievances at all. I don't have any regret. The most important thing, I showed interest to serve my people. And of course, if I didn't have the opportunity, it's not something that should be disturbing me. At any point in time, if I've been called upon to serve, I will serve. After all, I have also served at the local government, and we contested with somebody, he fell, and I won. Then along the line, I've been even given some appointments as as a politician, like during the beginning of APC on Plateau State. I think I was the director of research for the campaign for Governor Lalong, the former governor. And 2019, we were still in the campaign team. And at the federal level, I was the Buhari Support Organization Coordinator in Plateau State. At the end of the day, I was at least rewarded with board membership of one in Kano, one in Abuja. The one in Kano is Hadeja Jumare River Basin Development Authority. In Abuja is Agricultural Research Council of Nigeria. I spent 3-4 years consecutively in those places. So I offered my service or what I can do to the nation in those places also. So politics has been politics.
Yeah, as there are so many skirmishes going on the plateau, and more recent is the tribunal judgment so far. What is your take concerning those judgments?
Yes, you see, like I've been telling people, the part of democracy is for you to contest for election. You campaign, you contest, you win, you lose. Another part of it is the tribunals, and we're now at the stage of tribunal. So when some people begin to say, why did you go to court? Why did you do this? Then why did somebody contest? You contest, you fail. Yes, you have the right to go to tribunal if you are not happy with what happened. So I think it is part of democracy. It's the constitutional right of the individual to go to court. Let's get it that first. Because there's an INEC, which is an empire, and there are the judiciary, which should also say something. That is why I believe that what is going now is the correct thing that is happening. Blame nobody for going to court, or blame nobody for going to tribunal. Now, the judgment, I think the judgment are emanated from different tribunal. So, and each judge has a right to pass his own judgment the way he wants to pass it. And that is why there's appeal court, the Supreme Court. So you have to go through this thing before you reach the final. What is happening in Plateau State, yes, I know that some tribunals have said, like APC and other parties have gone to court to challenge PDP for lack of structure. Some tribunal, about 1, 2, 3 cases they have passed now, they've said yes, PDP has structure. Then about 3 or 4 of them, tribunal have passed their cases also, they say it doesn't have structure. But that's the beauty of judiciary. Yes, because I was jokingly telling people, when you have 3 lawyers to determine what is happening, the lawyer that is defending, the lawyer that is petitioning, and then the judge himself is a lawyer. So I think we should agree that the lawyers are doing their job. And lawyers have already told us that the judiciary is not it's not for the Christmas. So it depends on how you argue your case out, and it depends on your prayers, and it depends on your evidences. You can, if they tell you that this man steals something, and they took him to court and he escaped, it doesn't mean that he didn't steal. Maybe you didn't have evidence on him. So I think the tribunal are in the right place to tell us, using all their experience, to say this is this and this is that. So
Yeah, let us just roll a little bit. You were once a victim of local government dissolution, and we saw a repeat. This should be the third time on the plateau in the last three election cycles. Uh, the present PDP administration came on board to try to squash the local government. What is your take on that?
yes, well, to me, it's not actually correct, because we were the first victim, as I said, and we went to court. We won.
But your tenure was already
Yes, we couldn't go back. We won at the lower court, at the high court, and we won also at the appeal court. But we were not even allowed to go back. Now, the group that came afterwards that had this problem again is a group of the present governor on the Plateau State. Yes, so he had that, he was also a victim, and he also went to court. Now, I would have thought he would have corrected it, but unfortunately, he also dissolved it.
Do you think he was misguided, or though a barrister?
It's possible he was misguided. It's also
Do you
possible
see it as a vendetta to the past?
That's another possibility. It's possible that maybe he thought the group that dissolved him were right then. Otherwise, I don't see the reason. If you say he was not right, why would you even dissolve another thing? But to be honest, with the system of the local government, I think something is wrong. And I have always said, if we don't have credible election in the local government, it's going to give problem. Two, if we don't have a system that maybe they finish together with the governor, then it's going to be a problem. You imagine that you came as a governor and you have 17 chairmen who are in opposition. I think there's something we should look at it there. Then the system of election into the local government chairman system also is also, I don't like it, because every time it's the governor in power that takes all the seats. Is this really credible? So if we don't have credible, then supposing the governor is now coming as a governor and the local government that are existing, you have a mixture. Maybe it's fairer for him to contend. But when you come, you have 40 local governments. You see it as a threat. So sometimes they do those things to protect themselves. But so I think they should look at how do we prevent that. Yes, it's like everybody comes in, we dissolve. What else do we do? The constitution is not being obeyed. Even if you go to court, at the end of the day, implementation is poor. You win, the implementation is poor. So can we look around and say, okay, what do we do with the local government election system? Can we marry them together with the tenure of the governor so that they go together? And that means we should give them the 4 years tenure. Two, the election should be done by maybe INEC rather than the SEC, the State Electoral Commissions. Or even if the SECs are going to do it, let them do it transparently, fair and transparently, so that you cannot say you have it, like the last one they have done, is it in Edo or somewhere? It's PDP that cleared everything. You go to Kano, you have 40-something local government and plenty councillors. Then you say any party person cannot even get one seat. It's just the ruling party that will get. So I think something is wrong in the system of the election of the local government. They should correct that, so that if I come as a governor, that I have, just like in the nation, the president is there, but it's not a one-party system. We have governors from different parties. Mix up. Let's have something like that in the local government system. It will be better for us. Otherwise, you come, you get a writing. I'm going to work with 100% opposition. What happened? You see, others are being threatened.
Yeah, as 2027 is not too far. We believe that by 2026, electioneering process 2025 will start galvanizing. Are we seeing a doctor coming back on the stage? Have you
Yeah.
discarded that ambition?
Well, I anytime I want to go into election, I look at this idea of the zoning system because it's a gentleman's agreement, and I always wait for what is coming to our side.
Do you think it's democratic? Is it the best for
For
us as a
now,
nation?
for now, I've also said that zoning is not a very good system because it removes merits. But then the way we go about it in Nigeria, if you don't do that, then some places will be at disadvantage
Marginalized.
because you see everybody that come to power, he will try to take care of his people rather than the whole state or the whole nation. So you need to go around like that for everybody to have that idea. In the developed nation, like in America, when you have Bush senior and Bush junior taking, it's going to be very difficult in Nigeria to have that because if I come as an engassman, I take care of gas people. So my son come as an engassman, he take care of gas people. What happened to the other tribes on the plateau? So for now, I think that is what is disturbing us. We need to have selfless leaders that will take. If I'm a governor now, I treat every part of the state equal. Then we will not bother about who is coming, from where is he coming. We will not bother about zoning, but I think that will take time. And that is why I want to agree with the zoning for now. But we will keep on to develop, and zoning can go, and we look for merit.
So with the way the permutations and the calculations does not favor you to vie in 2027. Is
Even
that what you
if
are
even
saying?
if it favor me to vie, yes, I cannot go and vie without my people calling me. If I show interest and they say, "Oh yeah, continue," I will continue. But if I show interest and people say, "No, no, no, you should rest," doctor, I will humbly rest.
Yeah, as we come close to the interview, we have a new president at the helm of affair. Do you
Yes.
think it's in the right direction?
Yes,
Bola
for
Ahmed Tinubu.
Bola Ahmed Tinubu is now, for now, I will rate him that he's in the right track. We've seen some improvement.
In the last 100 days.
Yeah, we've seen, you see, the policies put on ground. You may not be able to see any fiscal structure, but if you have good policies put on ground, and he's going to use that policy for the next 4 years.
So you are one of the proponents of the fuel subsidy removal, despite it has affected your own business, private business.
Yes, it has affected it, but the aim of removing it is to even make life better. We've seen that fuel subsidy, they bring fuel, it is being, people pay for it, or the government pay for it, nothing comes in. So you waste a lot of resources. So he has removed it. He has said he's getting the money to use it for development. The only thing they have told us at one point, they said they have, yes, they have got about 1 point something trillion within 3 months. So, but maybe they have not started using it for us to see the impact. But I'm sure if they use it correctly, then it's going to help us.
Some has criticized the present administration to be a fallout of the Buhari nepotism direction where Fulanis were held fair. Today it's been termed as an Oduduwa republic. What is your take on
I'm not
that?
aware of that because when
All
he
the
made,
appointments.
yes, when he made appointment, people were very happy. I heard people say, we were fighting this man for no reason. He has given appointment to both to everywhere. In the East South is that he didn't have support. He gave them appointment. Especially like in Kaduna South, he didn't have any support there. He gave them appointment, and that the appointment is fairly spread. So I'm not even aware that this nepotistic idea into the system now. But for what we have seen now, I think it's fair enough.
Yeah, as we come to the close of the interview, are you happy with the present state of the plateau in terms of development, being a key critical stakeholder of this state?
I won't say I'm 100% happy. There's always room for development.
If you rate the state in terms of percentage development, where will you put plateau? Honestly, the world is watching and listening.
In Plateau State,
Yes.
when we talk about development, there are structure, there are security, there is everything. With all this, if you bring an average, I think I would give them just about 50 and above 50. Small.
Is there anything you expected us to ask you that we've not said that you want to pass through to the good people of Plateau State and Nigeria?
What I would like my people in Plateau State is peace. Let there be peace, and this development we're talking about, we'll get to that one. But once there is no peace, then there's problem. Well, once we have peace, you can construct road, you can construct, you can farm, you can even offer your health service. We have had a situation where people have to leave one particular local government because there were crashes there. The hospital was always closed down. So peace is very important. Peace is key to what we are doing. And I want to call on the good people of Plateau State to embrace each other and stay together. And the security should also help us in coping the insecurity. There's no way that you don't have criminal tendencies, but let the security also help us. Let the society also help us by reporting those people. Even if it is your son that is a criminal, please do something about him. Don't allow him. He's going to spoil a larger society.
Just as a rider, your principal, the leader of the APC on the plateau, was appointed as the Minister for Labour. Do you think it's in the right direction?
Well, for some time, yes, he's in the right direction because he has been a governor. So he has sat down on section of labor at this state level, and I don't think he has serious problem with the labor. He once, since he came, he has done very well because I can only remember only one or two times the state went on strike, especially towards the end of the day, the month. Sometimes the finishing is like that. But when he started in 2015, I think the civil servants were happy with him. And I wish he extended to the national level.
Thank you very much. Viewers, this is Nigeria at Dawn, and we will be speaking with the CMD of Hwolshe Medical Center, one-time local government chairman of Kanke local government, another person than Dr. Danlami Lenkop. It's a pleasure meeting you, sir.
Thank you very
We
much.
look forward to having more of you.
Thank you very
By the
much.
grace of
I am
God.
grateful. Yeah.
Sorry, we'll take a picture.
Okay.
Release all these two cameras.